For our final video, we need your help. While conducting our micro-CT scans, we've come across 3 strange and intriguing curiosities that we would like you to help identify for us. We'll walk through each one, showcasing the detailed scans, and we're calling on the viewers to share their insights. So watch closely and let us know your thoughts in the comments below.
So in this video I'm going to be inviting comments on abnormalities seen in 3 insects on micro CT. The first 2 are the wasp. These are both pre-hibernation queens collected by myself in British West Beccles and scanned by the long-suffering Nick Corr. And both the wasps were, to me, entirely normal when I caught them. I would just remind you that at this stage you would not expect to see any eggs. They are normally suppressed because of the so-called sexual diapause. Similarly, in any of the wasps, we wouldn't really expect to see much of the nervous system. We would see the brain, but as far as the 2 thoracic ganglia and those in the abdomen and the the ventral nerve cord, one does not usually see this. It is possible perhaps to see the first thoracic ganglia, but it's very rare. The other thing that one does not normally see is the dorsally placed heart and the valves, nor does one see the abdominal aorta. This is because the blood or lymph has a very similar attenuation to the structures surrounding it. Now, in the first of the abnormal scans, which is our pre-hibernation queen number 6, I'm going to be suggesting that abnormal amounts of radiopaque material has evaded being filtered in the normal way. It has exceeded the nathal sacs capacity and has passed distally down the bowel, causing multiple problems. Here's the evidence. So firstly, note that this wasp not only has material in her nathal pouch, it's stuck up here in the posterior pharynx. There's also material stuck in the esophagus halfway down the thorax, and in a moment we'll see there's all sorts of mayhem happening in the abdomen. So if we start at the front of the wasp and cut serially back towards the wasp's waist, here we're seeing the pharynx. We've cut back further and we're seeing the perfectly normal appearance in the nathal pouch of radiopaque material. But as we cut further back, this structure is appearing, or it's not a structure, it's this abnormal material stuck in the posterior pharynx. I'm going to also be suggesting that there's an abnormal amount of air between the muscle fibers of the adductor muscles to the mandible. Cutting back further still, we're now right at the back of the head, going into the thorax. We're seeing the large indirect flight muscles, and we're beginning now to see this structure, which becomes even more impressive. Now, nothing that size could have got there intact, so this, as I'm suggesting, is material that has solidified. I'm also suggesting that since the thoracic esophagus is here in the midline, that this is eroded through, and as you'll see in a moment, a bit of that material has broken off and is gone where it didn't oughter, as we'll see in a moment. So cutting back further, there now is some material in the subscutellar air sac. So, abnormal material in the pharynx and thorax. I'd like now to turn to the abdomen. So, a dorsal view cutting in. We're seeing that these aren't normal air sacs. This is air due to a perforation. We would not normally see, these are the abdominal protractor and retractor muscles. They're seen very clearly because of air surrounding them. We're also seeing this bowel abnormally well. Now, as we've said previously, normally we would expect to see perhaps the crop and a tiny little bit of the midgut, the ventriculus, but here we are seeing the vast majority of the intestine. We're also seeing radio-opaque material in the crop. We're seeing air surrounding the bowel, making it easier to see because of the contrast in attenuation values. I want you to notice that we're now also seeing eggs, and we've laboured the point, I know, but we would not normally expect to see eggs because of sexual diapause at this stage. And the next thing I'd like to point out is this structure here and this radio-translucent wiggly thing looking a bit like a snake. And I'm going to be suggesting that this is actually an abdominal ganglia as part of the nervous system, and this is the dual ventricular nerve cord. It's drawn as being straight, but as you can see, it's obviously quite bendy to go with the bending of the bowel. So abnormal over, abnormal air. I'm going to also be suggesting we're seeing very nicely the Malpighian tubules. We'll see them better in a moment. So now, looking from the side, I'm going to be suggesting that this black structure shown with the yellow arrow is actually air in the heart. If this was a human, you'd say this was an air embolus. We're also seeing the abdominal aorta. So we're seeing eggs, we're seeing dilated bowel, and we are seeing Malpighian tubules. On a transverse cut, again, we're seeing the eggs. I think rather better, we're seeing these little wiggly chaps, the Malpighian tubules. Now here we're not only seeing air between the muscle layers circularly, we're seeing it longitudinally. This we've done a double cut to see it rather better, and I think this is perhaps the best view of all of the Malpighian tubules. So again, there's the dorsal heart and the abdominal aorta and all the other mayhem we've talked about. We're also seeing the ovarioles as well as ova, and this structure here highlighted with the white arrow looking like a hot cross bun is actually the valve separating the crop from the beginning of the midgut. This is the pre-ventricular valve, shown well, and again beautifully shown the Malpighian tubules. More radio-opaque material in the crop. We're not only seeing the ovarioles, we're seeing this is the spermatheca, and these are just other views. So we've got to put this together as to why we should be seeing all these structures so abnormally well in a pre-hibernation queen. And the suggestion I'm going to be making is that the material has passed beyond the nathal pouch. It has solidified in both the posterior pharynx near the brain and in the mid-thorax as well as the abdomen. Now, for it to solidify like this, one wonders whether some of the material might have been some form of a cement, because this would be highly abnormal. There are obviously perforations in the abdomen. Air has tracked to between multiple tissues, making the definition of the heart, Malpighian tubules, ventricular nerve cord, etc. Extremely easy to see. And I'm suggesting that if this was a patient with a perforation, they might also have developed gas gangrene. I'm also open to suggestions as to why a pre-hibernation queen, who normally should not be forming eggs at this stage, is doing so. So suggestions, please. Passing to the second abnormality. This is an abnormal tracheal system in pre-hibernation queen 8. Now, normally, as we've seen on the video of wasp tracheal systems, there are two easily seen tracheal vessels passing through the wasp's waist, the petiole, and there is normally a large abdominal air sac on each side, designated number 10 by Snodgrass. So what's different about this one? On the left we have a normal tracheal system of the abdomen, the petiolar trachea, the very large abdominal sacs, and then the network passing down the lateral trunks with the individual spiracles feeding in. In wasp number 8, we first of all were totally unable to find any connection between the abdomen and thorax. There are no petiolar vessels. The lateral trunks are abnormally wide. There are no large abdominal sacs, 10, and in addition, between the spiracles number 7, there is an extra commissural trachea. I'm reminding you that spiracle 8 is actually inside the wasp's sting recess, so this is highly abnormal. Seen from the side, again, no petiolar vessel, so really no air communication between the abdomen and the thorax. Turning to the thorax, predictably then, this wasp did not have any connection, and I'm only going to show a couple of slides of the abnormal wasp, but in essence the rest of the system looked fairly similar, but like the proverbial son-in-law, not what one had hoped for. So here's a normal with nice air sacs around the around the muscles, the indirect flight muscles, and similar ones around the other indirect flight muscles. These were much less prominent in our abnormal wasp. So we've got a normal on the left, and we've got our funny bunny on the right. No connection between the two, and suboptimal tracheae in the thorax and in the head. I should say that this queen wasp in every other aspect was normal. She was making, or had stored plenty of fat, and showed every reason to have survived the winter and made a very good mother. So in summary then, this wasp had a markedly different tracheal system from any of the other 30 wasps that Nick looked at. We presume this was some kind of a congenital abnormality. There was also abnormalities in the tracheation of the thorax and head, and I would be interested to see whether anybody else had shown anything like this. I'm very interested at looking at other wasps with extremely thin waists to see whether any of them are going down this route. And finally, a quickie. We've already seen several scans of this locust, but the abnormality I wish to comment on is as follows. When we cut into the locust, you can see in the muscles, both the flight muscles and the muscles, the adductor mandibular muscles and the muscles in the legs, you can see these multiple white areas of high attenuation. These are seen better on a maximum intensity view, and the question for you all, ladies and gentlemen, is what is this appearance due to? Is it something that people commonly see? I certainly haven't. I wonder whether it's been caused by some kind of infection which has been walled off. How common is it? I'm going to bang on yet again by saying we wouldn't see this appearance had we stained the locust with Lugol's iodine.
If you're interested in getting your hands on a version of Dissect for you to use, you're in luck. Professor Duncan Bell is currently working on releasing a version that will be made available to the public. Should you be interested in learning more and getting access, feel free to contact him directly. I will now show his email on screen and leave the email also in the bio of the video.